haven't had a lot of surgery in my life. Getting my wisdom teeth out was the biggest surgery I'd had before my endometriosis excision. And when I woke up from getting my wisdom teeth out with a mouthful of gauze, I demanded to shake the doctor's hand because I felt that he had done a really good job. And then on the drive home, I asked my mom to stop at the shoe store, and when she wouldn't do it, I threw up. So based on my surgical experience, I wasn't sure what to expect from endometriosis surgery and the recovery period. And spending 10 hours throwing up from cramps and ending up in the ER 2 days before surgery, it didn't make me less anxious about how my body was going to react to this surgery. But I was so excited to finally, for the first time in my life, have a shot at actually getting rid of my period pain.
What's happening to your body, we don't know, because we've never really studied the female body. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because we've never really studied the female body.
Welcome back to CRAMPED, the podcast where I try to find answers to my, and other people's, questions about period pain. I'm your host, Kate Helen Downey. If you just found this podcast, you might want to start from the beginning of season 1 and get the whole story of my death cramps, some of the history of women's healthcare, and the reasons why we've never really studied the female body, like the song says. If you would like to support this podcast, and we really do rely on your support as a completely independent show, you can do that via our Patreon at patreon.com/cramped. And just a quick reminder at the top of the episode, I am not a doctor. This is not medical advice. I am just a research nerd with a uterus and a microphone who just got surgery, sharing what I've learned. This is part 2 of a 2-part episode on my endometriosis excision surgery. Last episode, we covered all the steps that led to my decision to get surgery and the logistical and administrative and financial preparations leading up to surgery and what was giving me the most anxiety. As of this recording, I am 4 weeks post-op. And in this episode, I'm walking you through my experience of the surgery itself, my recovery so far, and the answers that I have from the surgery and the pathology results. So let's get into it. The day of surgery, my partner and I got up at 3 a.m. to pack a hospital bag and get ready to leave. We were pretty sure I was going to be able to go home by the end of the day, but there was a chance I would have to stay overnight if there were complications. So we packed for that. I had to do an enema, which was not the most fun I've ever had. But hey, 2 days after throwing up and having diarrhea for 10 hours from cramps, my digestive system was still pretty cleared out. We drove in the dark to the hospital with no traffic, which only took like 25 minutes. We checked in at the front desk of the hospital, and at 5 a.m. on the dot, we were ushered into the next layer of check-in with a bunch of other people who were there to get surgeries. I confirmed my name and date of birth for the first of what feels like 100 times that day. I got a hospital bracelet, and then we were sent to a waiting room on the surgical floor. We waited a little over an hour, I think. It might have been 90 minutes. I was reading a book on my phone as pure distraction. I wasn't allowed to have anything to eat or drink, so I was getting really thirsty, and I had to keep using the bathroom because enemas work, you guys. Just sitting there waiting with no idea how long it would be was really hard. There was just like nothing to fill up that time. I was finally called to go into surgical prep, and my partner had to stay in the waiting room. But they told us we would get to see each other again before the surgery. I was sent to a numbered, curtained-off corner with a gurney and a monitor and a tray of equipment. I met my prep nurse, who confirmed my name and date of birth and the procedure I was having, again. She showed me the gown and the grippy socks that were laid out on the gurney for me and let me change. It was a paper gown, but it was much more complicated and like heavier duty than the paper gowns that I'm used to from doctor's offices. It had openings for tubes and 2 different layers of paper. Once I was in the gown and wearing the socks and had put on the hair covering, my nurse came back in and she was really warm and friendly. She was chit-chatting with me about her kids, generally just helping me relax while she got my IV put in and put on these leg massagers that would help with circulation during the surgery. My partner was brought back to join me, and he sat in a chair and held my hand, and we joked around a little. I felt calm, just still impatient to get to the surgery already. Next came a parade of doctors. First, my anesthesiologist, who, first order of business, confirmed my name, birth date, and the procedure I was having. And then she walked me through the drugs I'd be getting for anesthesia, how they would wake me up, what I would likely be feeling, probably drowsy, chance of nausea, but they medicate for that too. She explained that there was a chance of getting abrasions or cuts on my lip or the inside of my mouth, or even getting a chipped tooth from being intubated, but that the chances were low. She reminded me that when I woke up after surgery, my eyes might be dry, and I should really try not to rub them. And my partner confirmed that he was going to go get eye drops for me from the hospital store while I was in surgery. My general surgeon, who I had already met over Zoom, came in to, confirm my name, date of birth, and the procedure I was having, and ask if I had any questions about my appendix removal. I did not. My endosurgeon, who I had at this point met over Zoom a couple of times, he came in, and the very first thing he did was crouch down to my level, hold one of my hands in both of his, and look deeply into my eyes while saying, "Everything is going to go great today." I am 100% aware that this is something he probably learned at a seminar or from a study about surgical outcomes being improved by physical contact or eye contact with the patient, but I don't care, because it worked. After I had been asked what my name and date of birth was 20 different times, having my hand held and being reassured by the human being who was going to be rummaging around in my guts in half an hour, it almost made me cry. I already trusted this surgeon's knowledge and experience and judgment, but now I felt that trust as a physical relaxation. So well done, surgical seminar or study or whatever. Good job. He let me know that this was a teaching hospital and asked for my consent to have the surgical residents and the students come in to meet me, and I said, yes, I have seen Scrubs. 5 or 6 more people crowded into the little curtained-off corner to say hi. I didn't have a ton to say to them, and they didn't really have much to say to me. They looked kind of shy and nervous and just kind of smiled at me while my surgeon explained, again, what he would be doing during the surgery. He confirmed with my partner that a surgical nurse would be in touch with him via text to update him on how the surgery was going and let him know when I was coming out of surgery. The surgeon would come meet with my partner and go over the results of the surgery. After they all left, it was finally time to get some drugs and get wheeled into surgery. They gave me an IV drug that immediately rushed through me and made me feel warm and relaxed and peaceful. I hugged my husband and he went off to the waiting room. I was wheeled down some hallways and through some doors. When I was wheeled into the actual OR, I remember thinking in a kind of giddy way that this looks more like a really clean auto mechanic shop than what I expected an OR to look like from TV. This room was crowded with beige machines and a lot of people in masks and hair coverings moving around just between the machines. And I don't remember anything after that. I woke up in a bed in another curtained-off corner. The curtain was open, and the nurse was bustling around outside it, and she made eye contact with me and said something about me being awake. It was the same nurse that I had chatted with before the surgery, and it felt really good to see a familiar face, even if it was just someone I had seen earlier that day. I think I was going in and out of consciousness for a bit. I remember the nurse giving me a cup of ice with a spoon in it and being just so happy to have ice to eat. Like it was the best treat I could think of. That was probably either the drugs, the fact that I hadn't had anything to drink yet that day, or just the fact that I genuinely love to eat crushed ice. They brought my partner to me, and I was really happy to see him. I asked him if everything had gone okay, and he said yes. The surgeon had already talked him through everything that they had done, and he'd recorded it for me. After a while, the nurse asked how my pain was, and I told her I felt fine. She said it was time to try to pee. Being able to pee is one of the requirements for being discharged from the hospital after surgery. If you can't pee, you can't go home. 2 nurses helped me get out of bed and walk the short distance to a bathroom, and they made sure I didn't fall while I was pulling down the surgical gauze underwear and sitting down on the toilet. It really hurt to pee, but I could do it, so win. After they got me back into the bed, the pain had gotten much worse than it had been earlier. I told a nurse, and she said, yeah, of course, you got up, walked around, and peed. And then they gave me some IV pain meds and an anti-nausea because I was really scared that the pain meds would make me throw up. The only thing worse than throwing up after you just had your wisdom teeth out and your mouth is full of gauze might be throwing up after you just had abdominal surgery. So I was very anxious to avoid nausea. And luckily, I did not experience any nausea or vomiting after this surgery. After another hour or so of kind of going in and out, but mostly being awake, and the pain meds doing a decent job at controlling my pain, the nurse basically said, okay, time to go. We got our discharge paperwork, we got our instructions, we got my prescriptions, and the nurse called in a guy with a wheelchair. He got me into the wheelchair and wheeled me all the way down to the parking garage and helped me get in the car. I kind of couldn't believe they were just letting us go home. We had brought pillows so that I could recline the passenger seat all the way down, have one pillow behind my head and one on my stomach, creating a buffer between my belly and the seatbelt, which is something that I got from TikTok. My partner drove us home, and what had been a 25-minute drive at 4 a.m. became a 90-minute drive at 4 p.m. Gotta love LA. Every sharp turn, hard brake, or bump in the road, I could feel in my guts. I know it was a harrowing drive for him, trying to get us home quickly and safely, and every once in a while, making sure that I was still conscious. He did a really good job. So we were done with the surgery, and we were officially in the recovery stage. I had gotten a surgical recovery wedge pillow set from my local Buy Nothing group, which was really nice to have for keeping me sitting up comfortably without having to use my sore ab muscles. My partner made soup, and I wasn't super hungry, even though I hadn't eaten in almost 24 hours, but it felt good to get some light food into me. My partner set timers on his phone and kept me on my med schedule, which was mostly overlapping doses of ibuprofen and Tylenol with heavier-duty pain meds at night so I could sleep better. And the next couple days were easier than I had expected. I was sore and uncomfortable more than in pain. It hurt to pee for the next 12 hours, but that went away pretty quickly. The most pain I was in was from the gas they had used to inflate my abdomen during the surgery. I had heard a lot about this gas pain, so I was expecting it. And I knew it would show up as shoulder pain, even though the gas bubbles were actually sitting right below my diaphragm. And that is because the nerves in the diaphragm refer to the shoulders for some reason. But I hadn't expected to be able to feel the gas bubble the way that I did. I had expected it to feel like the way gas pain feels in your intestines, kind of sharp, squeezing pain as it moves through your system. But instead, I could literally feel a big bubble of air at the top of my abdomen. Like if I tilted to the right, the bubble would move and glorp around under my rib cage, and the pain would shift from my right shoulder to my left shoulder. I used a heating pad draped over my shoulders, which helped a lot, and Gas-X, which I don't think helped that much. I slept with one of those C-section recovery wraps around my belly to kind of hold in the bloat while I slept on my side at night, so that gas bubble was a little bit more contained. I had 5 small incisions, 4 that were about a ½ inch, and 1 that was inside my belly button. They were all closed with a clear surgical glue, so I could see them the whole time. I was told not to touch them, that they would fall off when the incisions were healed, and that it was okay to shower with them on. These incisions were tender but not painful. From that first evening at home, I could shuffle to the bathroom by myself, lower myself down on the toilet without help, and I could get into and out of the bed without help if I needed to. But it was really helpful to have my partner help lower me down into bed and help me get up, so I didn't have to use my stomach muscles as much those first 2 days. By day 3, I was taking little mini walks around the block and spending a little more time out in the house rather than in bed. By day 5, I wasn't taking any pain meds at all, even Tylenol or ibuprofen. I was sore, and I still had that gas bubble slopping around, but I wasn't in any pain. I will also say that having death cramps 2 days before surgery really put the recovery pain in perspective. Maybe I would have called what I was feeling pain if I hadn't just been in the most pain that my body ever feels. I watched a lot of TV shows that I'd seen before. I read a lot. In that first week, I actually baked a lot. I'm an anxiety baker anyway, and it made me feel really good to be able to make something and to be able to be in control of something, even if it was just a raspberry tart. By the end of the first week, I couldn't believe I'd just had surgery. I was walking a mile at a time, and I was impatient to get back to normal activities, even though I was still getting tired much quicker than usual, and I still had some brain fog. Day by day and week by week, things have gotten closer and closer to normal. The physical recovery has been the easiest and the smoothest, in terms of the incisions healing and the physical pain and the discomfort going away. The surgical glue on my incisions came off within a week and a half, and now at 4 weeks post-op, the incisions are just little red M dashes on my belly with little knots of scar tissue under the surface. The harder part of recovery for me has been my nervous system. The anesthesia seems to have knocked my circadian rhythm for a real loop, so I'm tired all day, and then I can't get to sleep at night. My battery gets drained by things that usually energize me. Things like being out of the house or social situations with lots of people. A week and a half after surgery, my partner and I went to a movie, so excited to be able to leave the house and do something normal. And then as soon as the movie ended, I told him, we need to go home right now. And then I cried in the car the whole way home because I was so overwhelmed and exhausted just from being out of the house. That was a shock, and we had to readjust our expectations of that phase of recovery. I'm still really frustrated sometimes when I plan to get a certain amount done in a day, and then I check in with myself and I realize my energy level is actually half of what it was yesterday, or I'm having a bad brain fog or anxiety day, and that if I force myself to do everything I plan to do, I would pay for it double the next day, which, if we're being honest, is probably the ideal way to go about living your life, and I've been doing the opposite for my entire adult life, but I guess we learn our lessons in our own time. We're going to take a quick ad break, and when we come back, I'm going to go over what I learned from the surgeon, what I learned from the pathology results, and what questions that I have had my whole life that I can finally answer.
Because we never really studied the female body.
Welcome back to CRAMPED. I'm recording this 4 weeks post-op for my endometriosis excision with the removal of a blocked and dilated fallopian tube and an appendectomy. Back in episode 4, I talked about an exhibit in a children's museum that I loved as a kid, where there was a model of a cow with a window in its side, so you could see how its 4 stomachs worked and where the milk was coming from. I said I wished there was such a thing as a cow window for people, so that I could see what was going on inside of me when I had death cramps. It turns out there is a cow window for people, and it's called laparoscopic surgery. It's not quite as fun as I remember that cow window being, but I sure did get a ton of information from it. Of the 5 small incisions that they made in my abdomen, the one that was inside my belly button was for a tiny camera, or actually a hollow chopstick kind of thing called a trocar, that a tiny camera on a scope went through. That camera captured photographs of my organs before and after the surgeons did their work. I will post some of these photos on Instagram at Kate Helen Downey if you want to take a look. I learned some really basic things that I never knew, like my ovaries are actually bright white and they kind of look like eggs. And that an appendix is just a little wormy looking thing that they can suck up like a wet noodle through a straw. I guess I never in my life pictured an appendix before. Or I guess if I did, I thought it was like a kidney or a liver. But it turns out livers are huge and appendixes are tiny. So what do I know about my endo and my period pain now? The good news, I had minimal endo. Most of it was concentrated on my left fallopian tube and on the front of my uterus. And the endo lesions that I did have were surface level, not deep infiltrating. And so they were pretty easily excised and cut away. The inside of my uterus didn't show any evidence of damage or of adenomyosis. And my liver, my diaphragm, and my intestines did not have any evidence of endometrial lesions or adhesions. The pathology results show that at least 2 of the removed lesions were confirmed endometriosis. So I do, in fact, have endometriosis. Suck it, every doctor I've ever had who told me I definitely didn't have it. So why was I in so much pain with my periods if my endo was fairly mild? Well, scarring and inflammation from the endolesions that were near the end of my left fallopian tube sealed the fallopian tube off. There's no way for them to tell when that happened, but based on my symptoms that started shortly after my first period, it was very early. That blocked fallopian tube filled with fluid, and that fluid was full of inflammatory cytokines, which are small proteins that signal to your immune system that something is wrong and that your immune system should send in the troops, and that causes inflammation. This blocked fallopian tube full of fluid basically turned into a water balloon at the end of a string. And to make it worse, this water balloon was also glued to the side of my uterus, my ovary, and my rectum with adhesions. Which is most likely why, on my ultrasounds, one of my ovaries had about half the follicles as the other ovary, because it had a fallopian tube full of goo glued to the side of it. So that's not a great situation just on its own. But when I would get my period, when my progesterone levels would plummet, releasing prostaglandins that signaled to my uterine muscles to squeeze and get rid of that built-up blood and tissue on the lining of my uterus, some of that blood was probably backflowing into my blocked fallopian tube, which expanded that water balloon even more, while the contractions of the uterus that the fallopian tube was glued to was tugging on the fallopian tube, tugging on the ovary, and tugging on the rectum, at the same time that all of those prostaglandins were creating more inflammation, and that fluid in the fallopian tube full of inflammatory cytokines was sloshing around into my uterus, causing more inflammation. So all this rampant inflammation and tugging on vital organs was triggering even more signals to my immune system and nervous system that something was very wrong, which, thanks to my last ER visit, I now know was triggering cyclic vomiting syndrome. That is, if you don't believe the nurse who told me it was triggered by taking an edible 48 hours earlier. So that is exactly what was happening inside my body when I was having death cramps. That is the question I've been trying to answer since I was 14. Literally, what is causing this pain? And I feel like I finally understand. It wasn't a simple answer, but finally, it makes sense. I haven't had my post-op appointment with my surgeon yet. That'll happen at 6 weeks post-op. At that point, he'll go through the pathology report with me and explain what it means, beyond the 2 positive endometriosis results. Just from reading the pathology report and Googling a lot of medical terms, it seems like there were a lot of excised lesions that didn't test positive for endometriosis, which I have a lot of questions about. Like, what caused those lesions? Why were there adhesions in places that I didn't test positive for endometriosis? Are those going to cause more and different problems than endometriosis? Should I be worried? What can I do to treat them? I have more questions that haven't been answered yet, and I don't know if I'll ever actually get answers to these. Like, why does my sister have almost the exact same symptoms as me if my symptoms were caused by one of very few endolesions that just happened to be right next to the opening of my fallopian tube, blocked it off, causing it to be full of inflammatory cytokines and adhering it to my other organs? Like, I know endometriosis is highly genetic, but if she has a similarly small number of lesions, how could they randomly be in the exact same place causing the exact same symptoms? Is the reason that none of our female relatives have had trouble with severe period pain maybe that a bunch of them actually had endo, but it wasn't severe, and they didn't get lesions in places that caused different problems leading to further pain? I suspect that we can't answer this question yet because we still don't know exactly where endometriosis comes from or why it develops in some people and not others. There may be lots of different kinds of endometriosis that grow differently. Hopefully someday, before I die, medical research will get there. One thing I was really anxious about was getting my first post-surgery period. My surgeon had warned me that the first couple periods after surgery could be pretty painful, which, with my history, worried me a lot. I think his exact words were, "Some patients say that they have the most painful periods of their lives after surgery." So yeah, I was pretty worried. I know from cycle tracking that I did not ovulate this month, which is fair enough. A bunch of my organs just got peeled like grapes, so take a month off. Yeah, don't ovulate. And I am pleased to report that I did get my first post-op period just a few days ago, and it did not kill me. I did have some pretty gnarly cramping, but it all stayed within the realm of regular cramping on my scale. I took a Valium when I first started cramping at 4 a.m., and then after that, I just took ibuprofen and used a TENS machine, and it was all okay. If it's not TMI, and I don't even know where the line is anymore in this podcast, day 1 of my period used to be a super light flow, like mostly just spotting with dark brown blood. And this time, it was more of a medium flow with bright red blood, which I think means that blood is not stagnating in my uterus. Which makes sense if there was a water balloon full of inflammatory cytokines and old period blood attached to my uterus that is no longer there. I hope my next period is even chiller. And even though I'm not foolish enough to hope for a completely cramp-free period in the future, I do hope that there is some point in the future where I get my period and I don't have to panic if I don't have my heavy-duty meds right near me. I hope that there's a time in the future where getting my period is just another normal thing that happens and doesn't require my life to stop. And I think that might be possible. There may be more steps on this journey, and I will never stop learning new things about my body, how it works, and how to take better care of it. But that's where I'm at right now. 4 weeks post-endometriosis excision, salpingectomy, and appendectomy. If you have any questions about any of my experience that I talked about today, please reach out. I would be happy to talk about this with you. You can find me on Instagram at Kate Helen Downey. You can join the Patreon at patreon.com/cramped, or you can email us at crampedpodcast@gmail.com. If this podcast has been useful to you, if you have learned something, please consider joining a paid tier on Patreon. This is a completely independent podcast, and I really want it to stay that way. See you next time. Cramped is hosted and created by me, Kate Helen Downey. Kelsey DeLonzo is our editorial producer. Sound design and mixing is by Kelly Kramerick at Maven Post Media. Our associate producer is Caitlin Sabater. Cramped's incredible theme song is written and performed by Faraday. Our podcast art was created by Nicholas Shepard. If this podcast has been useful or helpful to you, please give us a 5-star rating on Apple Podcasts or Spotify and leave us a review. We are an independent podcast, and taking just a minute to rate and review, it genuinely helps other people find us who might need this information.
What's happening to your body? We don't know because we've never really studied the female body.